and bretylium, okay, they are again blocking this release. So once again we can say that they are sympatholytics. So you see, as we are progressing with the story, I am telling you the name of the simple drugs. Okay, later on we will discuss other receptor blockers. But here I am not talking about the receptor blockers. Here I am talking about the ones who are interfering with the release only. Okay, so at every step who are blocking. So already we have discussed about that alpha methyl, then we have discussed about that methyl tyrosine, then we have discussed about reserpine. So all of them, they are blocking at different levels. So guanethidine and bretylium is also blocking it at a different level. Okay,
Yes, sir.
so these are going to block the exocytosis. Now the next step is that they have to bind to the receptor. So if we talk about that how they bind, so definitely now it is pretty simple that this norepinephrine, they will be released. Where are they released? They are released into that area called as the cleft. It is called a synaptic cleft. So they are released to the synaptic cleft, they will diffuse, and finally they will bind to the postsynaptic receptor. And if you look at this picture, do you notice ki the way some of these drugs, they are like, look at the cursor again, the way some of these drugs, they are binding to the postsynaptic receptor, but some drugs are also binding to the presynaptic receptor as well. So in the presynaptic membrane also norepinephrine's receptor is present. Understood? In the presynaptic receptor, the presynaptic membrane, I'm getting tongue twisters. So in the presynaptic membrane also there is present this receptor for norepinephrine. Understood? So not necessarily that all of them 100% will bind to the postsynaptic part. Some might bind to the presynaptic part as well. Okay.
Yes, sir.
Now,
Sir, what
yeah,
are the negative feedback there?
negative feedback. Yeah. We'll talk about it. But yes, true. Now the thing is this. Then it once we are talking about the postsynaptic receptor. So in the postsynaptic receptor, once it binds, so there will be some second messenger system which we have discussed previously long time back. We discussed in the beginning how the receptors they work. There are those G protein coupled receptors, GPCR, remember 7
Yes,
pass
sir.
serpentine. So those receptors will be present. Then there will be cyclic AMP formation, or there can be some situation where there was phosphatidyl inositol diphosphate PIP2 PIP2 breaking down into IP3 and DAG. You remember that we discussed that also. One mechanism was cyclic AMP mechanism, one mechanism was IP3 DAG mechanism. Two separate mechanisms were there, if you remember. So those mechanisms will get activated. Okay?
Yes, sir.
All right. Now here, if you talk about now who can block this area, so like I said, there is an entire big discussion waiting in the next class where we are going to talk about this adrenergic blockers. Okay, first we will not talk about the blockers, first we will talk about the agonists, but later on we have to talk about the antagonists also. So adrenergic blockers, there is not one drug, there are many drugs, and our entire discussion will be based on that. So I'm just mentioning over here adrenergic blockers will be blocking this area. So at every level we are getting some blockers. Okay, every level can be blocked by somebody or the other, isn't it? So once this entire thing is done, now our final step was, like I told you, removal of norepinephrine, because we don't want the action potential to go on forever. So if we talk about removal, so you will see that there can be a few ways of removal. Options are there. Again, you can follow my cursor. So see, way number one, that it diffuse out of the synaptic space and enter into general circulation. You see, this is where it is developing into inactive metabolites, and then it is going out through the urine. See, it is catecholamine, right? So since it is, do you know catecholamine? What is catecholamine? There is a catechol group present and all. Do you have idea about that? There are some,
Yes,
you know it,
yes,
right?
sir.
So catecholamines which are present over here, uh, you know, these molecules, they can actually pass out through the urine. Why? Because these molecules are charged molecules, they are polar molecules. Okay, so catecholamines are polar substances. So polar substances are aqueous soluble, they can dissolve in the urine. If it would have been lipid soluble, then it would have been difficult. So they would have got stored inside our body, but they are water soluble, so they will develop into inactive metabolites and they will pass out through urine. Now, second step. Now, if you look over here, now this is where my cursor is right now. So if you look over here, you will see that this norepinephrine, they are metabolized into O-methylated derivatives. Okay, and even I'll tell you. Okay, first let's talk about the second point that I have written on the screen. That one is this one. So this one is post-synaptic cell membrane related. So remember that it is metabolized into O-methylated derivatives by this post-synaptic cell membrane associated catechol O-methyl transferase. See, it is a catecholamine, right? So O-methylation of catecholamine. So what should be the name of the enzyme? Catechol O-methyl transferase. Methyl group is getting transferred. So if you recall in your biochemistry enzymology, so there was a classification of enzyme that entire world's enzymes can be classified only into 6 classes. You can group them into 6 classes. One such class was oxidoreductase, class 2 was transferase, 3 was hydrolase, and so on and so forth, if you remember. So class 2 enzyme was all those enzymes which can transfer one group to the other. Have you studied?
Yes, sir.
Yes. So you see, this is also that kind of a enzyme. So that is why the name transferase. So on catechol group, they are O-methylating it. So catechol O-methyl transferase. Catechol का C, O-methyl का OM, and transferase का T, COMT. Okay, so that's how the COMT comes up. So this is happening in the synaptic space. So that is another thing that is happening. And the third is that earlier one, that one which I was showing. So over here you will see this portion, this wala. Third is that they are recaptured by an uptake system that is going to pump the norepinephrine back into the neuron. ठीक है ना? And remember, this is pump. I use the word pump. So when I use the word pump, what do you think? It is like energy dependent or energy independent?
Energy dependent?
Yes, it is definitely energy dependent. So it involves sodium or potassium activated ATPase. Okay, sodium or potassium activated ATPase. Now, there is a drug that is called as tricyclic antidepressant, cocaine, imipramine. Okay, so these drugs, these are given to the patients. There are a lot of TCA drugs, tricyclic, these antidepressant drugs, which I hope from the name only you can understand, antidepressant. So why are they given? So one such name is imipramine. Cocaine, cocaine is a drug that is abused also, so I think everybody knows it. So these drugs, they actually block at this level, so they can block the reuptake mechanism. So what will happen if you block the reuptake mechanism? Are you understanding what will happen? See, if you block the reuptake mechanism, norepinephrine will be loaded into the synaptic space, they won't be taken up. So if it is getting loaded into the synaptic space, you remember we studied desensitization of the receptors?
Yes, sir.
So there will be desensitization of the receptor, and if there is desensitization of the receptor, then you will see that there will be action will be gone. So you see, if you are getting too much neurotransmission and everything, then this can also reduce, or it can cause desensitization. All right.
Yes, sir.
So uptake is very important. So you see, that's what I have written in the final line, that uptake of norepinephrine into the presynaptic neuron is the primary mechanism for termination of norepinephrine effects. Unless and until you are unless and until there is a reuptake mechanism, you are not at all terminating the action of norepinephrine. So what happens to this norepinephrine that is taken up? Fate of norepinephrine. See, one fate I have already taught you, that it develops into the inactive metabolites and then it is excreted in urine. Now, when it is excreted in urine, so in what form it is excreted? It is excreted as metanephrine, normetanephrine. Like, you have epinephrine and norepinephrine. Same way, you have metanephrine and normetanephrine. And also there is another compound that has got a little bit of long name, that is phenylyl mandelic acid. Okay, phenylyl mandelic acid. So these are the three forms. These are those inactive metabolites which are getting transported through urine. So that is the easiest part. Now comes up the actual, like, the brain twister portion. So what happens is that, see, once it is taken up, okay, let's go over here. So we have the neuron. So we have this neuron, and there is this reuptake mechanism, sodium or potassium dependent ATPases, which can be blocked by TCAs, and through this, let's say, this norepinephrine is taken back, norepinephrine enters in. Now what happens is, norepinephrine, this is derived from amino acid, like we discussed, dopamine, amine. So we have to oxidize it. These elements are called as monoamine. These are called as monoamine. They are all, amine derivative. So that is why we call them as monoamine. Like there are certain names where you will get the word amine in it. Histamine. So histamine is also a monoamine, amine derivative.
Yes,
There is another another chemical called as serotonin. What is serotonin? Serotonin is basically, if you read this pharmacology, you will come to know that it is actually 5-hydroxytryptamine. So 5-hydroxytryptamine. So for all of these things, there is one chemical which can actually oxidize it. So when these monoamines are oxidized, so it is monoamine oxidase. In short, it is MAO. Don't call it MAO. Okay, you can call it, I was kidding. Okay, but it is basically monoamine oxidase. So if
sir,
you I'll tell you. So there is one enzyme which is present, the slipper shaped structures present in a cell,
Yes, sir.
mitochondria. So these mitochondria, they have these monoamine oxidases. Now these monoamine oxidases, they actually oxidize this norepinephrine. Okay. So this is one way. Another way, another simple one, that is, they enter the adrenergic neuron, then they again go back to the vesicle. You remember that last time we discussed about that vesicle. And you remember there was this amine transporter. Through
Yes.
amine transporter, dopamine was entering. And now I am going to tell you that this same norepinephrine can also enter through this amine transporter. So this is way number 1. Way number 2 is that it is getting destroyed by monoamine oxidase. And third thing is that it doesn't enter only, and it gets converted into phenylyl mandelic acid, metanephrine and normetanephrine. So these are the 3 ways, 1, 2 and 3. These are the 3 possible fate of norepinephrine, the recaptured norepinephrine. Is the idea clear about the neurotransmission of the adrenergic neurons?
Yes, sir.
Yes, sir.
Cool. So now let's move on. Now we talk about the adrenergic receptors, which is also known as the adrenoceptors. So don't need to bother about the picture right now to a great level, we will grill on this thing for the next couple of moments. So if you talk about adrenergic receptor, like we discussed, it is called as adrenoceptor. So there are various types of adrenoceptors, like we have got alpha 1 and we have got alpha 2, okay, and then we have beta. Again, beta has got subunits like beta 1, beta 2, beta 3. So basically, if you like classify it, then you have got alpha and beta. Then alpha can be further classified into alpha 1 and alpha 2. Then beta receptor can be classified into beta 1 and beta 2. ठीक है ना? Now these like names, how do we get it? Effects on epinephrine, norepinephrine, and there is one more name you should come across, isoproterenol. Okay, so depending on how their behavior is with epinephrine, how their behavior is with norepinephrine, how their behavior is with isoproterenol, accordingly their names have been provided. Okay, and another thing is that here structure of the molecules are very important. Why? Because structure of the molecule, you will see as we will be proceeding ahead, we have to talk a little bit of structure of the molecule. I think you have got an idea. In cholinergic also we have discussed, quaternary amine, tertiary amine we have discussed, but over there we didn't see much specification related to the structure. In this chapter we will see a lot of specification related to the structure, and even receptor structure. Okay, receptor structure is also very important. So receptor structure also influence the affinity, whether it will bind or not. So first of all, to make it very easy, you remember that G stimulatory pathway. So we discussed about G stimulatory, GIGQ, GS, GIGQ. Do you remember that?
Yes, sir.
Haan.
Yes, sir.
So just for information, if we were discussing GS, so GS was basically adenylyl cyclase wala pathway, cyclic AMP, and GI was also similar, but it was having inhibitory effect. So GS was increasing cyclic AMP, GI was decreasing cyclic AMP. And if you remember what was GQ, GQ was basically the PIP2, IP3, DAG wala pathway. Just recalling, we discussed it previously. So if we talk about this beta receptor, now remember, easy to remember is, if we talk about beta receptor, beta works by G stimulatory pathway, always. So if there is beta, you start thinking about G stimulator. Okay, we will go step by step, otherwise it will be very confusing. So first step is, you have to think, if you are reading somewhere beta, in your mind the picture will be that in the postsynaptic portion, if there is beta receptor, that means inside there will be adenylyl cyclase present. Inside the cell there will be somewhere cyclic AMP is increasing. Okay.
Yes, sir.
Now, or any type of beta. Okay, beta 1, be it beta 1, be it beta 2, be it beta 3. It will be G stimulatory. This is like just the introductory knowledge. Don't focus on the locations and those things. Those things we will do gradually. As of now, you have to know about this beta. Now comes up this alpha. Now if we talk about this alpha 1 goes with GQ system and alpha 2 goes with GI system. So next time onwards, whenever we will be talking about alpha 1 receptor, you should always start thinking about the GQ receptors or GQ pathway, mane PI, that IP3 DAG wala pathway. But whenever we will talk about this alpha 2 receptors, you should always think about the GI pathway. Mane, do you understand one thing? Alpha 2 is always inhibitory, because GQ was also stimulatory, GS was also stimulatory. If you remember, only thing which was actually decreasing something, only thing which was not activating protein kinase A or protein kinase C, like if I am talking about in general protein kinase, if one receptor system was there which was not activating protein kinase, that was only G inhibitory. So alpha 2, do you think they can ever be stimulatory in nature?
Now, inhibitory হবে শুধু।
Yes. So this is always inhibitory. But rest, alpha 1 and then beta, they can be stimulatory. So here there is one more trick that has been provided. If you read books, you will find that, see, alpha 1, ONE 1. So if you remember ONE, then O for like blood, BLOOD. So if you remember the O gets with BLO, then O blow. If you remember, then blood vessel. N goes with the neck of bladder, neck of prostate, and neck of stomach. Okay, that means prostate gland. If we talk about prostate gland, then we have to talk about it. If we talk about neck of bladder means sphincter. So if we talk about the sphincter, then we have to talk about it. And in stomach, neck of stomach means the pyloric area. Okay, so if you recall that the last year again you studied about the digestive system. So if you remember the gut histology, the circular muscles, they were present guarding the pyloric area. Remember, of the stomach. Sphincter, pyloric sphincter they were forming. No? That is what I am talking about, na? Pyloric sphincter. So that sphincter is also there. So okay, so blood vessel ho gaya. Then we have got the pylorus wala area. Then we have got the urinary sphincter. Then we have got the this prostate. So this comes up in N. Okay, neck of bladder, prostate, stomach. Okay, and then comes up E. E goes with I. So in I we talk about the pupils. Okay, I'll tell you later on what happens over there. So like I'm just focusing on the way to remember. So here they have provided a way. So you can, if you can follow this way, it will be helpful. And for alpha 2, I don't think you need so much things. Just you have to remember that it is the GI pathways which is inhibitory. So here they have written TWO, terminal wearing off. I don't think that is necessary. Now, if you look at here in the lower part, that's beta 1. So beta 1, here they have asked you to remember in this way ki what is present as one unit in our body. Heart is a single structure. So rest all are paired, na? But heart is like one heart we have got. So one heart. So beta 1 goes with one heart. But heart is one, but lungs are 2. So you can remember with lungs, you can remember beta 2. Okay.
Yes, sir.
Like just a funny way to remember. That's it. Nothing special. Okay. So this is the thing. Now next thing that we have to talk about, that is this. Yes, the receptors. Now we are gradually getting into deep discussion. Nothing deep, very, very simple. So alpha adrenoceptors, basically the alpha receptors.